Hello YouTube, this is Dr. Vibe's Learning Point. In this video, we will complete the valvular heart disease and we will discuss about aortic regurgitation. So if you watched the video on mitral regurgitation, you might know what is the term regurgitation stand for. It stands for incomplete closure. So aortic regurgitation means incomplete closure of the aortic valve. Now let us study the etiology, what can be the causes. First, you can divide this into a valvular defect, and second, you can divide this into an aortic root dilatation. In valvular defects, you have chronic RHD and you have infective endocarditis. And in case of aortic root dilatation, you have conditions like ankylosing spondylitis, syphilitic aortis, and a connective tissue disorder that is Marfan syndrome. Let us study the hemodynamics or the pathophysiology of the condition. So if there is incomplete closure of the aortic valve, then there will be backflow of the blood into the left ventricle. So there will be volume overload in the left ventricle. This will cause this left ventricle to dilate and get hypertrophied. Eventually, it will lead to left ventricular failure. Now, if this pressure is transmitted upwards, the volume is transmitted upwards, it can lead to pulmonary congestion because the blood will go from the left atria to the pulmonary veins, to the pulmonary capillaries, and then to the lungs. In chronic stage, right heart failure features can also be present. Okay. Now, the two very important things, the symptoms and the signs that you get in aortic regurgitation is due to two important lines. One, that there is abrupt systolic distension due to the increased stroke volume. And there is rapid diastolic collapse due to diastolic backflow of the blood towards the left ventricle. This entire phenomenon is called as diastolic runoff. That means in systole, the left ventricle is contracting and there is increased stroke volume. And in diastole, there is backflow of the blood into the left ventricle. Now, what are the symptoms due to pulmonary congestion? You know that there is shortness of breath, dyspnea, orthopnea, and PND. You can better hear the palpitations in the left lateral position because the left ventricle is located in that position only. And also you get to hear a throbbing sensation in different parts of the body. This is due to the diastolic runoff. In signs, you will get JVP due to right ventricular failure in later stages. Now, specifically, if you come to the CVS examination, what are the sounds you will hear? S2 will be soft and only A2 will be produced. What will be the murmur? Very important thing. So, you consider the fact that blood is coming back to the left ventricle. And when will the blood come to the left ventricle in case of diastole? So, you get early diastolic murmur. And you hear it best in the neo-aortic area, that is the left third intercostal space. Now, this is a high-pitched murmur. You should remember this is a high-pitched murmur. And you hear this after full deep expiration. And as this is aortic area, you can best hear it in the leaning forward position. You can also hear a mid-systolic murmur, and that is due to the functional AS. Now, the most important thing in aortic regurgitation are the peripheral signs. So first, you have the de Musset sign. What happens in this? There is episodic head nodding with each systole. Then there is Corrigan sign and there is Corrigan pulse. Corrigan sign is the dancing carotid and Corrigan pulse is the water hammer pulse. Now, what happens to the blood pressure? So there is increased blood pressure, SBP. There is decreased DBP. So total pulse pressure, which is the difference of the SBP and the DBP, will naturally be increased. Now, why does this happen? Now, as the severity of the AR progresses, SBP can be normal or low normal. And DBP doesn't fall to that extent as it was falling in the initial stage. Okay. Now, let us come to the Hill sign. Normally, when you check the BP of the femoral artery and the brachial artery, you find that there is a difference of less than 20 mmHg. But in case of aortic regurgitation, this difference becomes more than 20 mmHg. This is called as Hill sign. What is Quinchy sign? So if you exert pressure on the tip of the nail, they will be flushing with each systole and they will be blanching with each diastole. Now you auscultate the femoral artery. With each systole, you will get a pistol shot sound in the femoral artery. Now, what is Durosay sign and Durosay murmur? D stands for D. That means when you compress the distal part of the femoral artery, you get a diastolic murmur. That is called as Durosay murmur. What is Durosay sign? Compression of the femoral artery in the distal part gives you diastolic murmur. Compression of the femoral artery in the proximal part gives you systolic murmur. This is called as Durosay sign. Let's come to investigations. And as in case of any CVS case, I've told you, chest X-ray, ECG, echo are very important. Now you will tell me the findings of the X-ray, ECG and echo in case of AR. And I am sure you will be able to say this because you have watched the other videos of valvular heart disease. I give you a hint. Here you have to consider what are the findings of left ventricular failure and then proceed with your investigatory findings. Let's come to treatment. As I told you that there is medical and surgical treatment. In case of medical treatment, you have to manage the complications. What are the complications of AR? Obviously left heart failure. In chronic stage there can be right heart failure as well. And obviously there is pulmonary arterial hypertension. I will soon be making a video on pulmonary arterial hypertension, so stay tuned. Well, so left heart failure, if it is acute case, you have to give MOND, that is morphine, oxygen, nitrates and diuretics. Why morphine? Because it can reduce the pain. Why nitrates? Because it is a vasodilator. Oxygen for symptomatic relief, and diuretics because there is volume overload, so there is edema. Now, in chronic stage, you have to add beta blockers and calcium channel blockers. In case of interventional treatment, surgery, you have the aortic valve replacement. Now, very important questions. What are the causes of mid-diastolic murmur? What are the causes of mid-systolic murmur in case of AS? So, one is a valvular defect in AS, that is particularly the aortic stenosis. And if there is a functional defect, then that is aortic regurgitation. The differences of these two are very important. So the question in Viva is, what are the differences of the mid-systolic murmur that you hear in case of AS and AR? In case of AS, there is ejection click as well. But in case of AR, there is no ejection click. And the second point of difference is that the turbulence of blood flow is very high in case of AS. So carotid propagation will be there. But there is no carotid propagation in case of AR. That means if you put a stethoscope in case of AS, you hear the same mid-systolic murmur in the aortic area and the carotid area. That's all about the video of the aortic regurgitation, and this was the last part of the valvular heart disease. Make sure that you answer the question that I have asked in the video. Thank you.